Hello everybody, good day and welcome to this amazing and mind-blowing video. Do you know that dental extractions are one of the most common procedures carried out on patients in the dental clinic? And are you aware that most patients most at times do forget the instructions given to them after these procedures, after dental extractions? Now, some people actually do forget, while some people just refuse to adhere to these instructions. So in today's video, I'm going to be outlining these instructions one after the other, so that in case you forgot what the dentist told you, you can make reference to this video and remind yourself. All right. And then for those who refuse to adhere to the instructions, I'm going to be telling you the consequences and the repercussions of your actions in this video. You are going to learn a lot, so please, I would love you to sit back and watch this video to the end. My name is Joel, and I'm your host for today. If you are new to our channel, please, I would love you to give us a like, share, comment, subscribe, and turn on the notification button so you get notified when next we release mind-blowing videos such as this. Now let's get into business. What are dental extractions? Dental extraction simply refers to the removal of a tooth or teeth from a patient's jaw. Maybe the teeth is infected, or maybe the teeth is causing pain and discomfort, or maybe it is growing in an unwanted place. Okay, so you go to the dental clinic and you have these teeth or tooth removed, right? Now that is simply what dental extractions are. We have two basic type of dental extractions. We have the simple extraction, and then we have the surgical extraction. The one to be performed on you is to be decided by your dentist based on the nature of your own condition, right? So when you get to the clinic, they will tell you which one they are going to do. All right, now let's get into business. What are those instructions that are given after dental extractions? Number one, now immediately after the extraction, they are going to put a gauze in your mouth. A gauze is a kind of white substance like cotton, right? They're going to put it in your mouth, in the socket, in the extraction side where the tooth was removed. Now the function of that gauze there is to stop or arrest bleeding, right? So it is your duty to bite that gauze as hard as possible in order for it to stop the bleeding as soon as possible. Okay, now you have to bite that gauze for a minimum of 3 to 5 hours. Make sure you bite it as hard as possible so that blood stops flowing. And then you have to ensure that you do not rinse your mouth or spit out. Now, rinsing your mouth with water can actually make blood to start flowing again. It can wash away the clotted blood and make blood to start flowing again, okay? And then avoid spitting out. Whatever is in your mouth, it's your saliva, it's your blood. Just swallow it and let it go like that, okay? The next instruction that is going to be given is that you avoid hot food. Yeah, hot and pepperish food. You avoid these foods because it is capable of starting the bleeding all over again, and it's capable of irritating the place, causing infections, pains, and delaying the recovery. Okay, so you have to make it a point of contact, a point of duty, I mean, to avoid hot and pepperish food. Now, next on the list, you have to make sure that you do not put your finger or your tongue in the extraction site. Yeah, a lot of times, a lot of people feel like, okay, let me feel how deep it is, or maybe children, they want to play around that place and all of that. So avoid putting your hand or your tongue there. Why? Because the tongue can actually bruise up the place, and then your finger can carry infections down there. All right, so you have to make sure as much as possible that you avoid putting your tongue or your finger in the extraction site. All right, next on the list is that you have to make sure that you consume only soft food. You can go for pap, you can go for tea, you can go for golden morn cornflakes or some stuff like that, right? As much as possible, make sure you avoid food that is hard until you are fully recovered. All right, then you have to make sure that you brush softly and gently. When you are brushing your mouth that night before going to bed, make sure you brush softly and gently to avoid bruising up the place and causing bleeding all over again. Okay, Good. And then you have to make sure that you stop smoking. If you know you're a smoker, if you know you're addicted to smoking, if you know you're used to smoking, if you know you smoke once in a while, you have to ensure that you stop smoking at least until you have fully recovered. It is for your own good, okay? So I want to plead that you stop smoking as much as possible, okay? Now, after your extractions, when you get back home, in 4 to 5 hours after the extraction, you can take out your gauze, all right? And then you start taking your medications. Make sure you are consistent with your medications. Take it until the prescription has elapsed, right? Now, when you start taking your medications for that day, the next day in the morning when you wake up, definitely there will be no pain in your mouth. You feel as if everything has passed, okay? Now you are going to start what we call the warm salt water therapy, right? The warm salt water therapy simply means you get a cup of warm water and then put a teaspoon of normal table salt, normal sodium chloride. You put it inside the warm water and stir it. You now use that water to rinse your mouth. Now you rinse your mouth, do not swallow. I repeat, please do not swallow, okay? Now you rinse your mouth and then you spit it out. Do not swallow. Now when you rinse in your mouth, make sure you hold it for a few seconds on the side where your tooth was extracted, or either the left or the right, upper or lower. You just direct the warm salt water to that side. The warm salt water has two basic functions, right? Now, number one is that it has bacteriostatic abilities, which means that it stops the growth of harmful bacteria in the mouth that can delay the healing process. And then number two is that the water improves internal blood flow, which in turns improve the recovery rate, okay? So you have to make sure that you carry out your warm salt water therapy effectively. So now when you get your cup of warm water and salt, you rinse your mouth and spit out until the water is exhausted. Just a little, maybe like 30 cl or so, right? Just like 30 cl, yeah. So you rinse your mouth and spit out. You are going to do it 2 times in the morning, 2 times in the afternoon, and 2 times in the evening. 6 times every day for 3 to 5 days, right? Good. It is very important for you to remember this because it is one of the most important uh, instructions to follow in order to maintain full recovery. Okay, so make sure you do your warm salt water therapy. Let me explain it again. I said you are going to get a warm about 30 cl of warm water. You put a teaspoon of table salt inside and stir. You rinse your mouth, do not swallow. You spit it out until the water is exhausted. So you do that 2 times in the morning, 2 times in the afternoon, 2 times in the evening, preferably before meal. So one before breakfast, one after breakfast, one before lunch, one after lunch, one before dinner, and one after dinner. You are going to do that for 3 to 5 days. If you obey these instructions, I want to assure you that before your 5 days are over, you'll be fully recovered and you are good to go to carry on with your daily activities. Now, the last and the most important thing is that you need to go and get a replacement at the dental clinic as soon as possible. Okay, you need to go and get a replacement. Why? Because you see, getting a replacement will perform two functions. It will stop what we call the overgrowth of the opposing tooth, right? When a teeth is extracted, the teeth that is opposite it, either up or down, tends to overgrow and occupy that space, which will cause malocclusion, will cause pain, will cause discomfort, and may later need to be extracted. And you see, that's why you will not like. Okay, now the second importance of replacement is that it prevents the tilting of the adjacent tooth, right? Because of the missing tooth there, the teeth that are close to that space will tend to tilt and occupy that space, thereby causing malocclusion again and causing some discomfort. Okay, so please, it's important for you to go and get a replacement as much as possible. Now, failure to adhere to these instructions can actually cause infection in the mouth or in the affected area, which can delay the healing process. It can lead to gingivitis and can possibly lead to the infection of other healthy tooth, and before you know, you have to remove and remove and remove more teeth, which I'm sure you will not like. Okay, and then it can also lead to what we call dental dry socket or dental osteitis, which will result to bad mouth odor, pain, swelling, delay of healing, and other oral conditions. Okay, so it's important for you to adhere to these instructions in order to maintain full recovery and to prevent oral complications. Okay, so in my next video, I'm going to talk about different types of dental restorations available. As much as I know, I'm going to talk about their cost, how they are made, and which one is best, right? So please make sure you subscribe to this channel so you get notified when that video is ready. I hope you find this video interesting and educating at the same time. So if you do, please, I would love you to share this video to your loved ones, to your friends, your relatives, well-wishers, and everybody so they get informed. Feel free to let me know what you feel about this video in the comment section. Maybe there's something I'm missing, or how was your experience? If you've ever experienced dental extractions before, what was the experience, and all of that.